Kegels. Kegel exercises are very much recommended during pregnancy, but a lot of women are confused on how to do it. Am I doing it right? So in this video, let us look at what are Kegel exercises, what are the pelvic floor muscles and its importance, and how to correctly do Kegel exercises to get a lot of benefits during pregnancy. So stay tuned till the end of this video. Hi, I am Saranya, the founder of Babypedia, a birth professional and a life coach for pregnant women. In this video, let us discuss about a very common term that you will hear during pregnancy called Kegel exercises. So first, before we talk about Kegel exercises, you should know what is the pelvic floor muscles, because when you do these Kegel exercises, you are actually strengthening this pelvic floor muscles. Now, I want you to just close your eyes and take a deep breath in and breathe out through your mouth and see if you can feel any movement in your vaginal muscles or in your vulva. Do you feel a set of muscles just pulling in and then pushing out when you breathe in and out? Well, those are your pelvic floor muscles. The pelvic floor muscles are essentially like a hammock. It goes from the front of your pelvis to the back of your pelvis, and this holds all the internal organs in place. So the pelvic floor muscles is where you have all your three openings. Okay, so you have your vaginal opening, you have your anal opening, and you have your urinal opening. So these muscles take on extra work during pregnancy because already it is holding on to all the organs and it is ensuring that everything is staying in place. During pregnancy, added on, your uterus is growing, your baby's weight, so your pelvic floor muscles are working overtime to take care of all this, to bear the weight of your baby and the uterus as well. That is why during pregnancy, it is recommended to strengthen your pelvic floor muscles. Because if you don't strengthen, there's a high chance that they can become weak. And after you give birth, you can experience issues because of a weak or a tight pelvic floor. Like in urine incontinence, you leak a little bit of urine, or sudden urgency in urinating, pain while having intercourse, so lower back pain. These are all different things that you can experience if you have a very weak or a very tight pelvic floor muscles. Okay. So now, how do you do your Kegels? Kegels are nothing but a basic way of tightening and relaxing your pelvic floor muscles. Okay. So now first you have to identify your pelvic floor muscles. How do you identify your pelvic floor muscles? You can do it in two ways. One, when you are urinating, stop your urine midstream. Okay, when you stop your urine midstream, notice which muscles you are engaging. The set of muscles that you are lifting to tighten to stop urinating are your pelvic floor muscles. If you are not able to get it right, then sit on the edge of your chair. Okay, lean forward as much as you can and cough. When you cough, when you're leaning forward at the edge of your chair, you will see a set of muscles go out and come in. Those are your pelvic floor muscles. Now, I don't recommend doing it often or stopping your urine midstream often because it could lead to urinary tract infection. So do it once or twice, and then once you identify your pelvic floor muscles, stop, trying to identify or stopping your urine midstream. Okay. Now that you've identified your pelvic floor muscles, next, how do you do Kegels? There are different levels. Okay. So let's look at the basic level. Basic level is nothing but just tightening your muscles, just like how you did when you wanted to stop your urine, and then relaxing. Tighten and relax. So tightening will look something like closing and lifting. Okay, and then you're relaxing. So it's coming down and it's opening. Again, close and lift and down and open. So start doing this consciously. You can do it sitting, lying down. If you're finding it difficult to do it sitting or standing, lie down, bend your knees a little, and you will be able to do it more easily. Now, as you start doing this and strengthening your pelvic floor, when you can do around 20 to 30 continuously, you can shift to the next level. So the level 2 would be tightening and holding it for 5 seconds and then relaxing. Again, tighten, hold for 5 seconds and relax. Okay, so this is the next level. And the final level would be, think of your pelvic floor as an elevator or a lift in the building, where the ground floor or zero is very relaxed. The first floor is a little tight, second floor is a little more tight, and the third floor is very tight. Okay, so now what we're going to do is relax your pelvic floor fully, lift it a little. Okay, you're reaching the first floor, then lift it a little more, second floor, lift it a little more, third floor, hold for a few counts, then relax, go to the second floor, little more first flow, and then totally relax. Now this is the expert level, okay? So start with the basic. Just tighten, relax. Next, start holding it in the tight position for a few seconds and then relax. And then you can try the elevator or the lift. Okay, so these are all progressive ways of strengthening your pelvic floor. When you are doing Kegels, I want you to take note of a couple of factors, okay? Try not to tighten your buttocks, your thighs, your abdomen. Try to isolate only your pelvic floor muscles as much as you can and do. That is very important. Two, if you're feeling any sort of discomfort or pain when you do these, please stop immediately. Meet up with your doctor or a women's health physiotherapist. Ask your doctor for recommendations. They will give you somebody, they will recommend somebody who's good with pregnant mothers, and you can check with them and then you can continue doing them. Very important, please coordinate your breathing with the when you are doing your Kegels. That's a very big mistake a lot of us make, where we hold our breath when we are doing Kegels. Okay, so I want you to slowly breathe in when you are doing or breathe out. Sometimes the opposite will feel comfortable. So the thing is, you have to breathe when you are doing, do what works for you. Some others say, when I'm breathing in, especially if you're somebody who does abdominal breathing or deep breathing, when you breathe in and expand your belly, your pelvic floor will also relax and expand. And then when you're breathing out and contracting your stomach, your pelvic floor will also lift up. Okay, so coordinate your breathing and breathe when you are doing your Kegels. Do not hold your breath. That's very important. All right. The final thing, this is like very, very, very important, is relaxation is as important as tightening. Lot of us will tighten and not relax fully. We'll just come down and then tighten again and then do it halfway. No, relax as much as you can, because when you only do the tightening, you will get an over tight pelvic floor, which also has disadvantages. We don't want that. We want a well functioning pelvic floor. So lift and relax. You should be relaxing as much as you can. Don't strain and push yourself, but as much as you can. And then again tighten and then relax. Okay. So now in this video, we've spoken about what is the pelvic floor muscles, how to identify your pelvic floor, how to do Kegels in varying progressions, level 1, level 2, level 3. And very importantly, coordinate with your breathing and don't forget to relax your pelvic floor. If you found this video useful, don't forget to like, share it with another mother who will benefit, and subscribe for more such informative videos. I will see you soon in another interesting video. Till then, this is Saranya with lots of love and strength to you. Take care.